Hi, Jim Paoletti, pharmacist, fellow in functional medicine. I want to talk to you for a short while on patient assessment. If you're going to balance somebody's hormones correctly, it all starts with proper patient assessment. And this consists of two parts. Patient symptoms. Need a thorough and comprehensive assessment of patient symptoms. This includes symptoms they're experiencing now, symptoms they've had the last few years, any changes, maybe even symptoms early in their life. A good medical history, in other words. The second part is testing. You must measure the hormones, baseline, to see where you're at. You cannot properly do physiological hormone replacement unless you correlate the symptoms along with the testing results. It's very dangerous to dose hormones based just on symptoms, and this is because of two main reasons. First of all, the symptoms of hormone imbalances overlap so much. The symptoms of low estrogen overlap with the symptoms of high cortisol, low cortisol, poor nutrition, poor estrogen metabolism. You have to figure out where the problem lies, and that's why you have to correlate the symptoms with the actual testing result. The second reason is because in many cases, too much hormone mimics the symptoms of too little hormone. Too much estrogen looks just like too little estrogen. Too much testosterone looks like too little testosterone. And this occurs because of what we call receptor tachyphylaxis. When you first give a patient a hormone, most commonly what happens is you increase that hormone's receptors in numbers and sensitivity, so you get an increased genomic response. If you want a hormone's activity, you need two things. You need the hormone and the hormone receptor, both functioning at physiological amounts. If you give too much, you get an initial increase in response, but then the brain will downregulate that hormone's receptors. So now it doesn't matter how much hormone you have, you don't get the genomic response you want. So, very important to remember, too much hormone can look just like too little hormone.